everyone. Chapter 4, Criminal Acts and Intentional Torts. What's a tort? That's kind of a fun word, right? Well, you're going to find out what it is in Chapter 4. We'll talk about criminal acts such as robbery, murder, attempted murder, euthanasia, that's a big one, manslaughter. How does that pertain in healthcare? There is a lot of things, right? If we overdose a patient and it causes them to pass away, if we purposefully give a medication that we know is going to cause a bad reaction, anything of that sort. So especially you guys in healthcare, you're kind of the second eyes for the doctor. Sometimes he's running through and he may get confused or mixed up, or there might be an accident somewhere in there. You guys need to look at the chart and be like, oh, wait, this patient isn't on XY medication. Are we sure we want to give it? Because it interacts with their other stuff. So just bringing it back to the doctor. Oh, hey, do we know that this is going to interact with their other medication that they're on? Or did you realize that they were on this other medication? And the doctor may be like, yep, we're totally giving it. That's what needs to happen. Or, oh my gosh, I did not know that. Let's change this. Good catch, right? And I cannot tell you how many nurses, medical assistants, PAs have caught issues or concerns or cross-referenced medications to find out that could have caused a serious injury to one of the patients. So it is really important that you guys pay attention to that stuff. We'll talk about abuse again, what mandated court reporters are, and it goes into it a little bit more than the previous chapters, talking about elder and child abuse, things to look for, and what your roles and responsibilities are in the healthcare system. We will also go over fraud, sexual assault, all of that. So it's going to review the chapters previously, go a little bit more into depth, and give you guys a couple more new terms. Fraud happens a lot in healthcare as well. Overcharging, billing is a big thing. Billing and coding can sometimes be confusing or complex. And knowing that what your state allows, how I can bill, how many items I can bill for in a day, how long the doctor was seeing the patient, what level of care was given. So making sure that you guys are paying attention to that and knowing what the rules and regulations are for not only your facility, but for your state and for our national coverage. Kickbacks and anti-kickbacks. It will also jump into HIPAA a little bit more in this chapter. Embezzlement, search and seizure, prescription drugs, and a whole array of criminal acts and intentional torts. We don't always associate some of these criminal acts in the healthcare field, but they do happen, and you guys do need to be aware of them so that you can properly inform those channels that may need to be informed to keep yourself out of hot water and to keep your facility running above board and really servicing your patients the best way that they need to be serviced. So if you guys have any questions or concerns, feel free to reach out. Thanks.